Welcome to Kuseli Cafe, to our second season, Norway, Your Way. I'm Dariella Scavino.
And I'm Nina Kozłowska. Today we're going to talk about healthcare in Norway. First, an important disclaimer is that we are not experts in that area. So we will share personal experience, some information, but for more solid information, read more at helsenorge.no. Okay, we're going to start with a story. So, Dariella, what was your first experience with healthcare in Norway? Tell us.
Yes, my very first experience when I arrived in Norway, I moved in the pandemic in 2020, and I moved on winter time. I arrived 1st of November, and after 4 months here, I felt very, very weak. Like I could notice that my body was super weak. And I wanted to reach out to the doctor. And my husband saw a sign in the train station about an attendance in the comuna. I had by then still international insurance because I just arrived and I was presenting all the papers in the police and in the ad for the residency. And I said, well, I can use my international insurance anyway in the same place. So we called, well, he called because I didn't speak Norwegian, not even what I speak now. And I said, yeah, she can come with her passport because, of course, I didn't have or D number or ID number. So I went for a blood test and find out that, of course, like many of you, if you are foreigners in another country and come from a different latitude, I was missing vitamin D. So I started drinking my vitamin D and I got stronger and have more energy again. But that was a very good option that I found it was public healthcare. It was nice to know that I could reach to a doctor, not even needing to call the insurance and do all the process. It was just there in the comuna. And I'm sure that other comunas work like that as well. And that was my first contact with a fastlege here in Norway. Because in Norway, we have a fastlege. Everyone that lives here has assigned a person. So if you don't have your ID number and you receive your letter with your fastlege name, what do you do?
Yeah.
So, you can use your international insurance in any private hospital or check out if in your comuna there is this service for foreigners who are just around in the process of residencies or maybe just as tourists probably too.
So the important information is that healthcare in Norway is a right to everyone. So even before you have your residency, and that's very important. As Darila said, we when you sign up to healthcare system, you choose your fastlege. So it's a general practitioner. You choose your doctor, and this will be your doctor like kind of first point to get to any other doctors. So whenever you need to go to some other specialist, gynecologist or others, you first need to have an appointment with your fastlege and explain that you need this other service, and they will just probably make some magic in the system and allow you to do that.
Yeah.
How
is it in Poland? Do you have a GP as well before going to a specialist?
Yes, but you can go to every doctor. You don't have to go to yours, I think. At least I didn't have mine for like many years. And even if you have your one, you can go to the other also. And first, usually you need to go to general practitioner for this piece of paper that says, yeah, she needs to go to see the I don't know, some other specialist. But the exception, the exception is the gynecologist. So you don't need a reason to go to gynecologist. Like you don't need to be sick or something, because of course you need to do checkups. Maybe you need, you just have some questions. Maybe you need contraceptives. So yeah, this for
They
me, it
say.
was very natural that to the gynecologist, you just go, you don't need a reason. And here it's different. Apparently, you need a reason. But yeah,
Yes,
this is
it
how
is
it is.
very different for me too. And it's for me it's super different because before I would go straight to the specialist without requiring go first to a general practitioner. For me, honestly, between us two and listeners, that was not a positive change. Because I already, well, I grew up with another system where I was very comfortable and I already have my specialist in everything I needed. I have my gynecologist I will go to for that special needs, or my dermatologist for another matters. And I have already a specialist that I have chosen among others, because it's you can choose anyone you want according to your insurance, and I was very happy with it. So coming to a system where they say this is just the one, you cannot jump it. You have
Mhm.
to go there. I thought, oh, this is kind of bureaucratic.
Yeah.
But then they said, well, but you can change it if you don't like it. And that's the possibility that you can go into Health Norge and change what, twice a year your GP if you're fast leg,
Mhm.
in case you are not
Or if you
satisfied with
are,
him.
and of course, if you are moving, you can also change them. So we also changed from Horten to Oslo, obviously.
Well, not
So
so obvious because we moved from Lillestrøm to Horten, and my husband kept his fast leg because, yeah, he knows her, she knows him, and he's happy with the service. So you could keep it, as you
yeah,
can see.
you're right. You're right. Well, we changed it, and yeah, we have an app where we can sign up for the visit or book an appointment. So that's also very nice for internationals who don't want to speak Norwegian over the phone. That's very convenient. Usually the queue is not very long. But sometimes you need to wait like half an hour or something. You have an appointment, but still, it's mm, yeah. It maybe you will have to wait for some time. But I think comparing to Poland and the national healthcare, the queues go faster than in Poland. Yeah,
Yes,
although the
I
last
have both experience. I'm sorry.
and also the last few years in Poland, I had the private insurance. It was so much easier and faster, and I had an app, and especially with the pregnancy, it was so much better, and the healthcare was amazing. That I had a lot of checkups. They were very often, and some blood tests and stuff like that. So I liked it a lot. I imagine it's a bit worse. I wasn't pregnant in Norway. But I imagine it's not that great. But then again, mine was a private insurance experience, and that was not so expensive in Poland. And then also a lot of companies offer private insurance just as a benefit. So I also got that from my employer.
Mhm.
And here I haven't checked, but I imagine that the private care is could be very expensive, and it's not a standard as a benefit for employers. At least I haven't heard of it.
I don't know. Maybe expats can tell us if they are for a short time, if they need to have a private insurance. I would guess it's not a need. As long as you are in Norway, you have the right to use the public. And what I was going to say is that I have a different fastleges because I was in Lillestrøm and I moved to Horten. And when I moved to Horten, all fastleges were full. So I have to have one in Tonsberg. And finally there was a spot here and I changed to have it near. I was pregnant. I didn't want to travel, no, half an hour just for the checkup. And
Of course.
the appointment of your fast leg is 15 minutes. That was a change because when I used to go to my doctor in Peru, I could be half an hour depending on the matter. And we talk a lot, so I could go deeply, make also many questions. And here it was more it's more because there's another one behind, but doesn't mean that you don't wait. I have waited a lot in my fast leg because fast leggers, in my experience, they are full of patients. Like they have a long queue, and if you have an emergency or you have not a life that emergency, just a fever and something you really need to check up, you don't go to the legevakt for an emergency. They tell you go to your fast leg. And if you go to fast leg, they are gonna put you between their appointments, and you see a lot of people. So it's not very fast. And another thing is that then they send you to the specialist in case it's needed, and sometimes that can take a lot, like a month. It's not so very fast. When I was pregnant, it was a priority, as we have shared in our episode number 9 as expat mothers in Norway. You can read that episode as well to learn a little of my experience pregnant, and also Nina's as a mother here in Norway, and how was the healthcare. So in Norway, the health system is very efficient, I would say. But sometimes you have to wait. Sometimes there is a queue.
Of course, it changes, and that depends on the day. But that is right. That also that changes. That is a big difference for me than the doctors in the general practitioner in Poland. Is that they in Poland they don't do. They would only like advise you, can like check on you. I don't know, for example, if you have a cold, like check your throat and maybe listen to your lungs and stuff like that. Write the prescription, but they are not doing anything. How to say that? Kind of on you. So you were right that when, for example, when I went with Felix. I wanted to go to emergency room in Norway because he had this like very small tick. It was the first one, and I couldn't get it out. It was so small. Then they told us to go to fastlege, and we could come without the appointment, without the waiting in the queue. I mean, maybe a little bit as he finished with another patient, but we could go in, and he actually took care of it very smoothly. So I was actually surprised. And also they have blood tests. They do blood tests at the fastlege. So when I came this winter with cold or some influenza that was for longer period of time, and started to be very hard on me. When I came, first thing they did was I haven't spoken to the fastlege, but they did my blood test, and when I had an appointment at the fastlege, like 10 minutes later, he already had the results, and he could tell me, "Oh, it's not bacterial, so you're not gonna get antibiotics. I advise you this or that. Maybe try this syrup." He did his prescription, and that was very efficient. And in Poland, I would say that it is not fact based. They don't do the test, but they would just say, "Oh, take these 5 different drugs, like for this, for that, for cough, for whatever," and they would like overdo with the prescriptions that I would always get a lot of stuff. So then I would avoid going to the doctor when I had a cold or anything or influenza, because I didn't think it was an actual, I don't know, actual advice or knowledge. It was like a bunch of different drugs for everything. And then I would just put it into my body, and I felt it's too much. So I like this
Yes.
approach.
Yes, when you go to the fastlege, although it's like a office of a doctor, has attached a little lab for basic. And when, of course, they can do a blood test for a virus, but if you have further, they send it to a lab, and it takes up to a week, in my experience, to have the answer. And the answer won't arrive to you. He won't call you unless you have something. So it's funny because if you know about me, if I call you, Dariella, it's because you have something. If you don't hear from me, forget it. It's fine.
Oh my God.
So you can actually go to Helse Norge and check some of these lab results, but you have to ask, because it's not just one platform. It's sometimes 2 or 3, depending on the provider of the analysis. Yeah, you have touched a very critical point, and it's about the medicine, and something I think is very positive here in Norway, and that they don't fill you with drugs, because it's a world experience, and we have suffered a pandemic, and so how the excess of antibiotics can really damage your resistance. And whenever you really need one, then it's going to work the same way, using my super technical language now. But so when you go to the doctor, sometimes they call them paracetamol doctors, because paracetamol, yes, if it hurts, paracetamol. If you feel bad, paracetamol. But that's all you get.
If you give birth,
unless it's
paracetamol.
critical. They give you your gram of paracetamol for the rest days.
But yeah, exactly. And that is also my experience comparing Poland and here. When I went to the doctor with Felix, here they also don't give a lot of drugs to kids. The approach is usually like, if it's not that bad, we're not gonna do the blood test, because that could be very hard for the child. And if the doctor does not suspect that it might be a bacteria, he thinks it's a virus, because kindergarten in winter or in autumn. So then the approach is, oh well, it's the small kids, it's the barnehage. I also have kids, so I understand that. So and then I was a bit frustrated with that, but I maybe understood it, and yeah, this is how it is. And then you will get more of like, I mean, in a way, it was comforting that he was like understanding, like, yeah, I get it. It might be hard. Try, I don't know, some home remedies and stuff, but we're not gonna put him through the blood test. We're not gonna give the drugs, because it's probably not gonna help. And also that the kids needs to gain this resistance, and it's part of the experience. So it's
I like that.
It's not undermining the experience, because cold for kids and parents can be very hard, because no one sleeps. You are sleep deprived, and you come to the doctor. So at least you get this, yeah, I get it, but it is how it is.
Well, he was empathic. I'm going to share that I have empathic service, but I'm going to share one situation where it wasn't. So don't expect everyone in Norway, or because you're in Norway, they're going to smile at you. It happens internationally. Sometimes nurses, and they can be tired.
Yeah, well, that depends on the person, not on the nationality.
Yeah, totally. So my first, I have a daughter, and her first high fever, it was persistent. I was trying with some water and some natural way, let's say, comforting her, but it persisted, and it was 39. And I said, okay, we take her to the emergency room, because we don't have anything home. And for me, it's very natural that if you really have the need for medical assistance, you go. Yeah. And when we arrived to the legevakt, or emergency room, they look at Lara, the person there, look at her and said, she looks fine to me. And she said, and I explained what I'm just telling you. She's been with a fever, persistent fever. And yes, I'm a new mother. So yes, I'm nervous. But anyway, she needs care. And she said, you have to come when she's 41 of fever, 41 degrees of fever. Oh my God. That's what she said in my face. And at that moment, I thought, wow, in Peru, I would have gone, they would have attended her, and they would never say that. Okay. So she was not empathic, but at the same time, she was very high the standard to reach emergency. I mean, I need to be near death to go.
Yeah.
I'm not a doctor. Should I self medicate? And then, after, of course, having a very polite conversation with the person, she said they were giving her pancet. How much? I don't have. You don't have? Like, should I have drugs in my house to auto-medicate my newborn? As a new mother, I have no. I'm not a pediatrician. I don't know.
Yeah.
It's new, and even if I would, I think the health system should assist you. And there was no one else in the room. It's not that it was busy. Here I have a dead person. No,
Yeah.
empty. A weekend. Yes, it was a weekend. So that was not a good experience at the end. By persisting, is that she sold me the medication, which we paid, and they told me how to give it to her. And from then on, I knew how to react in case of a fever. But we know that persistent fever can also have a very bad outcome. So I think it's important that you can reach out whenever you feel you have the need. But sometimes I can see it also in my husband. He's Norwegian. He doesn't reach medical care unless it's very, very important. Like, you let them, the people that need, use it. But it hurts your shoulder very bad for 2 months. Yeah, but it's not that bad. When
It's
you need
not
to be
falling
dying from your
over.
shoulder, it's just you're losing your arm only. No, he finally went to his fast leg after persistence, and at
Yeah.
least we knew what he had. You know, yeah.
Yeah, that
So
is that must have been very stressful for you. Yeah, I can imagine that maybe they have some other rules, and as immigrants, as expats, we need to kind of learn the rules, like what, like not to go to the hospital because they're not going to help you anyway in that at some situation, but go to directly to fast leg with this and that. Okay, this is one thing that we need to learn this. But the other thing, and that's on the people working in healthcare, is to be simply empathetic and nice. And of course, maybe it's true. It's hard, but I mean, people in stressful emergencies, they need that. Especially with small kids, the first time something happens, like Felix said, this first tick, I was nearly panicking. I was very stressed about it, even though I had them before. But then the next one, and I was less stressed. But sometimes just having this empathetic person that would say, I understand, but you need to do this and that, and provide
yeah,
just with helpful advice, and definitely not to judge you that you don't have a drug at home,
a
because
drug at home.
yeah.
I'm already there. Like, I'm not on the phone. Yeah, you can
Yeah.
tell me stay your house. No, I already took the sick child there because I think it's needed. Yeah. So that's
Hmm.
a story. And something you have probably noticed if you are abroad and you don't know is that in Norway, children go to your same fast leg. Yeah. My daughter doesn't have a pediatrician assigned. Since she was born, the first 3 years the child goes to a nurse. It's a hälsosika player in the comuna where they have the checkups and the vaccines. And annually, there is a doctor there in the same hälsostation or medical center who's gonna measure, see the ear, the eyes, the tongue, and the check of the child. And they have this app where you can follow uh, which curve is the child. And it's actually, Nina can share her story about it, but it's different from my experience in Peru and Argentina, that every child has a pediatrician. It's not a GP that is going to send you to a pediatrician, but it's going to go to a specific child doctor that his whole medical specialty is children. So the children here start going to the Fastlege when they are 3, and he is gonna tell if it's out of his scope, if the child needs to actually go to a pediatrician.
Mm-hmm. Yeah, so I can share my experience with Helsestation. I really like this institution, this place. It's Helse means health, so it's like station for health. I don't know, literally.
Yeah.
So you don't go there when you are sick. It's more to prevent. My experience with it is mostly with Felix. And you also go there when you are pregnant, but I was not pregnant in Norway, so I only know some stories of other people. But basically, when you come with a child, our experience was that they not only vaccinated him or checked him physically, but the nurse would also talk with us about his development, about what he eats. We could ask her for advice, so like how to convince him to eat more of this and that. Or she also shared the information. She also shared some information on several occasions about different development specifics of the time that we were there. So like 2 years, 3 years old, she would show us some illustration of the brain and explained how it works, that he doesn't have the cortex developed yet, and explained about the emotions, how to react, what to do. So I could ask her specific, like when the tantrum occurs and he does this and that, what to do. She would tell us. So that was very informative, but also she would check his language development skills, and even when he didn't speak Norwegian yet, but he was already in kindergarten and understood the Norwegian, she would have these toys to like and give him some tasks like put the doll on a chair and stuff like that to see if he understands, if he follows. And these meetings would usually be around 1 hour. And as I like to talk, that's new. I would always be there as long as I could, because this was I really liked this lady, and she was really helpful, and she would always at every time she would tell us, look at us and tell us, you are good parents, you are doing an amazing job, don't worry about this and that. We would mostly we liked to go there more often than it's mandatory, to hear these words.
I can tell
And
because normally it's half an hour and you are talking about 1 hour
yes,
session.
and also every time she would ask, first thing, it was not how is the child, is he okay, it wasn't about him only, it was how are you doing, how are you feeling. We would share, for example, that we are sleep deprived. We talked about sleep. She was like, I understand. It is very hard. You can try this and that. We discussed what methods to do. We discussed, how to stop breastfeeding and stuff like that. So my experience is that it was the best, the most advice about motherhood, about kids, but like even daily life, not the health, but the daily life that I got was from this lady, and I will be forever grateful for that. And also that in Poland you have to pay for these services, like it's not one place for it, but for example, you with a child, you go to the doctor for these measurements and health checkup, stuff like that. It's one thing, vaccines and everything. And if you have some problems like I don't know, in language development, you go to another specialist. Probably you would have to pay. Maybe you have problems with breastfeeding, you go to yet another specialist. Maybe it's a problem with sleep, you go to the sleep consultant, and that's a separate service. And here we had everything in one person for free. So that is very much appreciated.
Yeah, I was in the same commune as Nina with my pregnancy and Lara. So we can tell where is it. We don't have to because I already know where we live.
Yeah.
I don't know if it's nationwide like that, but I also have a very positive experience. They were very empathetic and very comfortable to go to their place. They're very flexible. And that's something that we can also no, point out that you have 1 hour because you also ask, talk with her. I mean, if you wouldn't look for it, they are not going to look for you. Hey, Nina, you want to come extra time? No, it's like there is a communication there, and that's important that we take accountability. We need to take responsibility of our health always. No one gonna take care of you and tell you, oh, this is the perfect system. What do you need, Dariella? No, I have to go. I have to think about it and look for the help, and alternatives are there. Yes, you already talked about a little of pricing. We can share what we know about money expenses
Yeah.
in the health
One more thing
system.
before, because I just remembered that when we first came to health station for the first visit, we said that we don't speak Norwegian and we spoke English. But she also said that it's available to have a translation on the phone.
Yes.
And actually, first time we used it. Because she wanted to, but then it was not really, you couldn't have this flow of a conversation with a translator. So later on we didn't use it and we just spoke English, and it was also fine. But just to say that it is an option. So maybe
Yes.
also some of the health nurses, they are maybe more comfortable speaking Norwegian through the translation, and then you get more information in your language. So that's also good. And yeah.
Yes, that's a
Uh,
right. For any health session, you can ask for a translator, and it's free too.
yeah, about the pricing. Uh, Generally, it's whenever you go to fastlege, so this general practitioner, or any other specialist, you need to. It's covered by the insurance, but also by you. So you need to pay around 200 krona. It somehow fluctuates. So check the actual pricing for the current time that you need it. But from my experience, it was usually around, it was like 180, 200 kronas for the visit. And you just receive a factura invoice after the visit, and you have some time to pay it.
Yeah,
Mm,
it changes that. It's funny because it's not always the same. Sometimes you say you pay by beeps, you pay now, or they send you a link on SMS, or you receive an invoice in the post kasse
mhm,
in your mail. I have all the methods because of the different for the moving. They was
mhm.
different. You end up paying. It's no problem if you don't pay the same day. It's okay. You pay later.
Yeah, exactly. And also for the blood test, I had to pay. So for this visit, when I also had blood test, of course, I had to also pay. And the kids don't pay. Service is for free until they are adults, so 18 years old. And the very important information is that if you use this service, the healthcare service, a lot, so maybe you go a lot to the doctor, you've been sick a lot, maybe you have some more health problems, you're paying this around 200 krona per visit, but until a limit. So when you reach a limit of 2000 krona, you don't have to pay for the next visit. So
Yeah, I didn't know that.
if yeah
Thank you,
yeah
Nina.
if even though they're yeah, it's like you have to pay, so it's different than in some other countries where healthcare is for free. And that's one aspect, but there is a limit, and I think it's very fair. So that also maybe people don't go to the doctors just because they really need um, they really need to have a problem. And as you said, it's even in their, I don't know, DNA, that they don't
Well,
they really need a reason.
I mean, this country, we should have another episode about how this country is wealthy. It depends so much on their culture. They are not going to abuse stuff. Not because there is a lot of money, we should, let's buy all Ferrari for every Norwegian. No, they have this conscious of having enough.
Hmm.
So another Kuseli Cafe could be about that.
Yes.
And regards of the prices, in my experience, all the exams, maybe if you need an ultrasound or you need a blood test, a urine test, and echography, you pay something. We cannot talk about prices because it could vary depend on the study that you do. And the medicine also, you pay something when you go. You go with they just go with your name to any pharmacy in Norway, and they know which is your receipt. What do you need? And all these expenses are also subsidized, so you don't pay 100% of the medicine.
But
Mhm.
man, are medicine expensive in Norway? Whenever we go to Poland, we buy this, but just this one that you don't need a prescription, like paracetamol for kids and syrup for coughing, because oh my God, you will need that as a mother of a child in kindergarten. So not for me, but for him, or like just some painkillers and stuff like that. This is much cheaper in Poland. So whenever you are traveling from Norway to Poland, get some souvenir paracetamol.
Yeah,
um,
I read some other foreigners that come from the US, and they are so fan of their painkillers. Said every time I go to the US, I buy my painkillers because here in Norway I don't get it or they're expensive, and they are not the same. Yes, they are not the same because sometimes the drugs here are not allowed. The Norwegian health system has, of course, their own rules and their own the medicine that it's allowed to use and sell in Norway. And normally I see that people follows that. So if you want advice even in what to eat or how to self-medicate things like a painkiller, I'm not going to talk about a big disease. You go to Health Norge and there is a blog and there is a lot of information. There is a lot of information about how to breastfeed, for example. As mother, I was reading a lot, so I can tell that there is a lot of information about the children and motherhood in Health Norge. And there is an app as well. The app there are two apps, one for like the web where you can book your appointment, change your appointment, cancel your appointment, or reach your fast leg and reach your exams and etc. And another one for children when you have a child where you can put the progress in terms of weight, size, head size,
mhm.
etc. Very important things when you have a little baby. How is it growing?
Yes. Uh,
Ah,
Also, one more thing that is quite different for me here than in Poland when it comes to healthcare is that you can, as you said, you can call the doctor, you can call the hospital when you are in labor, and you call your hospital. That's like you know in which hospital you're gonna be giving birth, and you can call them, and they tell you when to come to the hospital. So like they can advise you on the phone in case of the labor. I'm not an expert, but I don't think this one is really good because over the phone they can't really. I don't think they can really assess what in what stage are you, let's say. But for also you can call when your child is sick and something has happened. Like once Felix, we had a little accident. He fell down on the just on the pave walk. And he had here on the forehead a little red bump, or will be bump at that point. And I was very stressed. I didn't know what to do. And my sister told me that you can call the fastlege, or you can, I'm not sure if it's fastlege, but you can call some health advisors. I'm not sure if it's not your, it doesn't have to be your doctor. You just call the general number for your area. And you can also have a video call. So you can, for example, show the child and like, oh, is this thing that he has on forehead critical or not? Should I come to fastlege or emergency room, and what to do? So this is another particular thing, I would say.
Yeah. Yes. So take responsibility of your health. We share our stories about what we know, but of course, again, like Nina said, for any detail, go to helsenorge.no and really see the information you need. This is not for medical advice or really to go in details about pricing or processing in healthcare. I would say that as a general, in balance, I can say yes. I like the system here. I've been there is a good support in children. It's not perfect. There are some downsides from the system side. Like my sisters have, she was with the pediatrician all the time with the first child, and she has 3. Now she's my pediatrician. I call my sister. She has so much experience. But yeah, she was talking with the pediatrician so much, and I felt a little jealous. Like I would like to have the pediatrician too. Anytime I have a very important question, not to say,
Of course.
she just fell on the floor. No, really, she really bugged. What should I do? Yeah, that would be nice because we don't know. We are not experts,
Of
but
course.
it's
And
important to. Yeah.
yeah, I think it's also it can be a different experience dealing with healthcare in Norway if you are generally quite healthy anyway. So maybe it's a cold, it's something with kids, but influenza, stuff like that. But I don't know about the when you actually have some disease, and about the diagnosis, like if they diagnose early or late. So this is also just dealing with healthcare as a generally health person could be completely different experience than someone who spends lots of time with doctors in hospitals and maybe stuff like that. So of course our episode is based on our experiences.
Yes.
And I just wanted to share at the end something interesting. In the 2024 World Index of Healthcare Innovation, Norway was ranked as fifth, as the fifth country in the world. So it's in the World Index. And the dimension performance was quality. So generally, the quality of the healthcare was very high. Then Norway would even be fourth. At the fourth place, but there was more dimensions, so there was also choice, and this means that Norwegians or people who live in Norway don't have so much of a choice when it comes to making some decisions about their treatments. The other dimension was science and technology, and then Norway was in medical advances at the 15th place, and scientific discoveries 13th place. So not great, not terrible, more in the middle. And
How many countries? Because sometimes we don't
fiscal
know from the
sustainability.
200 countries or how many countries is the list. But anyway, it's a very good. However long the list is, fifth is great. And that as a pedestrian, I'm going to say, walking the streets, I can see that if you have a disability, if you're missing a prosthesis, if you need technology in hand, I don't know if Norway is developing, but it has it. I can see everyone here that has a disability. I mean, a physical problem that requires a transplant or some, how do you say, some tools, elements that are going to make your life easier that are really, really expensive. That I have to think in Peru, you need to be or rich or be lucky to be in the list in the health system to get it. Here, everybody I see has it. It's amazing because you can also see elderlies that they can have everything they need to move around. They have these little cars or little motorized vehicles where they can move around on summer, and even on winter they have their winter vehicle, so they can have a life where they can move more freely, and that is part of the benefit of the health system.
Also, people with some serious disabilities, adults and kids, they can have personal assistants that are subsidized subsidized by Norwegian government, by the system. So that's another insight.
Yes. Yes, I got sorry, but now that you say that, I remember seeing how they come with the ambulance taxi, let's say, because when they come to pick you up to go to your appointment, and even if you could go alone if you can, maybe you need some assistance, so they make it easy for you. And for in Latin America, you normally struggle a lot to have a wheelchair. So yeah, that's very good for Norway.
It would be very very interesting to maybe host at our podcast someone, some expert with disabilities. So if you listen to us and you would like to share your story and experience, reach out, and that would be nice to explore how is Norway for people who have disabilities or struggle with something.
Yes, we are opening our podcast and to welcome visitors. So if you can, if you want to share your story in Norway, how is your way in Norway? Contact us on our social media, on Instagram, YouTube. YouTube, you can comment, you cannot message. So it is our Instagram, or comment our Spotify, @kuselicafe_podcast. We would love to hear your story. If you want to participate, or just send us your story and we can read it. It always nurtures when you reach out, because also that nurtures what we are going to share and what are the episodes about.
Thank you for today. Thank you for listening. I hope it was informative. And ha det bra.
Ha det bra.